Hey everyone, Bridget here at the AAFE Training Center. We are just going to be treating my patient with some neurotoxin. So I'm right now just marking up her frontalis, making sure I'm getting an even spread where my dots are. I'm going to then move on to my glabella, marking the ends of my tails. And we're going to be treating her procerus medial and lateral corrugators. And then the last thing that I'm marking up is just her crow's feet, and we're going to do 4 injection sites on her. I'm making sure to stay outside of my orbital rim, and let's get started. So I always like to start going from left to right. However, you can kind of start going wherever you want to. I always make sure to mark my lateral borders because if we don't treat all the way out to where she has movement, she's going to get what's called a spocked brow. Some patients really like this look. She in particular does not want that. So we're making sure to treat all the way out to my lateral border. I'm making sure to stay about like a finger breadth above the brow to prevent any brow dropping. She does have a smaller sized forehead, so I didn't really need to make that many dots on her, but if someone has a larger forehead, just make sure that you have at least a finger breadth above the brows. I'm now going straight into my procerus, giving what I need to give, moving on to my medial and lateral corrugators. Always making sure to pick up and isolate those muscles as we want to prevent any lid ptosis. We also want to watch our depth here because our frontalis sits right underneath of these muscles. So we want to make sure we're 3/4 of our needle depth on our medial corrugator and half our needle depth on the lateral corrugator to just prevent any dropping of the brow medially. Lastly here, I'm going to get started on her crow's feet. So we're making sure that we are outside the orbital rim. I kind of put my finger on the orbital rim and roll it out, and that's where I place my dots. We also want to make sure our depth is very superficial as the muscle is pretty thin, and also all of our smile muscles that run below it, like the zygomaticus major and minor, are deeper. So we want to make sure we are not injecting into those and affect her smile in any way. And then as you'll see, I'm going to wipe up and away for everything. We don't want to rub down. We don't want to rub toward our eyes. We want to rub up and away for all of these injection points. I'm going to make sure to tell her to no touching her face for 4 hours, no exercise for 4 hours, and also no laying flat for 4 hours to prevent any movement of this neurotoxin. Thanks so much for watching.